What happens to oxygen with sickle cell trait? Have you ever wondered how sickle cell trait affects oxygen in the body? Let's dive into this topic and explore the fascinating relationship between sickle cell trait and oxygen transport. In individuals with sickle cell trait, the hemoglobin in red blood cells functions similarly to normal hemoglobin, especially under typical oxygen levels. This means that for most people with sickle cell trait, oxygen delivery to tissues remains effective. However, things change when oxygen levels drop significantly. When oxygen tension, which is the partial pressure of oxygen, decreases, the red blood cells with sickle cell trait can start to change shape. They can become more rigid and take on a sickle shape. This change occurs at lower oxygen levels than in sickle cell disease, but it can still impact blood flow. The sickling can reduce the ability of these cells to transport oxygen efficiently, although the effects are generally less severe compared to those experienced in sickle cell disease. Specifically, red blood cells in individuals with sickle cell trait maintain their normal shape and oxygen-carrying capacity at oxygen tensions above approximately 38 millimeters of mercury. Once oxygen levels drop below this threshold, some red blood cells may begin to sickle. This sickling can slow down blood flow because the cells become less flexible. It's important to note that sickle cell trait involves only one mutated hemoglobin gene. This means that most of the hemoglobin in the body is normal, allowing for effective oxygen transport under normal conditions. However, in extreme situations like high altitudes, severe dehydration, or intense physical exertion, the sickling of red blood cells can increase temporarily. This can potentially affect oxygen delivery in certain tissues. In summary, while oxygen is primarily carried normally in individuals with sickle cell trait, some sickling can occur under low oxygen conditions. This can slightly impair blood flow and oxygen delivery, but most people with sickle cell trait do not experience symptoms. In contrast, sickle cell disease leads to more severe sickling and significant oxygen deprivation due to the abnormal hemoglobin. Understanding these differences helps highlight why sickle cell trait is often considered a milder condition. Always remember to consult healthcare professionals for personalized advice regarding sickle cell trait and its effects on health.